that a lady is who has got full bladder, she rushes into the toilet. You just pass urine straight away. You cannot hold on to your urine for some time because it can be corrected by precautions and by medicines. Recently, there have been a lot of controversies and discussions over urination in public. Now, let me present the other side of the story. The man, 65-year-old, he comes to my clinic and says he has difficulty in holding on to his urine. So much so that if he's in the queue, he passes urine in his pants and the pants become wet. People may or may not notice it. But this is a real big problem. Imagine, as shown in one of the advertisements, that a lady who has got full bladder, she rushes into the toilet, but the toilet is occupied. So now what does this lady do? She's not doing it on purpose, but she's got a condition which is called overactive bladder. There are certain other situations where there may be urge incontinence. Urge incontinence, that is, after urgency, you just pass urine straight away. You cannot hold on to your urine for some time. A typical example of this is when you're stuck in the traffic, you can neither leave the car nor can you hold the urine. It's a very embarrassing and difficult situation for many men and women, especially as their age advances. So today, I'm going to talk about what measures you can take or persons can take who've got this problem to at least keep it under control and avoid embarrassment in public. I'll divide this into two measures: preventive measures and curative measures. Now, first and foremost on preventive measures is that when you step out of your house, always go to the toilet before you step out. Similarly, when you reach your destination, the first thing you have to do is to go to the toilet, whether you're feeling like passing urine or not, because one of the reasons is a hypersensitive bladder, and if there's a sensation, it's very difficult to hold on to it. So don't wait for the sensation to come. You just pass urine and empty your bladder. That will make you comfortable. Attached to this is the fact that whenever you reach an unknown destination, for example, a restaurant, always check out where the loo is, because when you want to pass urine, you won't have the time to hold on to it. So always find a toilet, ask the people there, and keep it in mind. It's a corollary is that in the aeroplanes, the air hostess talks about 2 doors in the front, 2 doors in the back. But what is important to you is which toilets are where. 2 toilets in front, 2 toilets in the back. Just make a visual assessment of that. And when you're doing some journey, like going in a plane, don't drink a lot of water before you start for the journey. Hard drinks are definitely no, because it's much better to avoid these things than to have embarrassment later on in the plane or in a restaurant. One thing that's come up very well nowadays is the use of incontinence pads. Male incontinence pads are very freely available. They are not that expensive, and you can use them for journeys. That way, you will be confident and you will avoid accidents. So much so for the precautions that you can take. Are there any curative things that can be done? This urgency and urge incontinence is a global phenomenon and it's been there for some time, but the treatments have changed over the years. First and foremost thing is you must recognize that there is a problem which needs expert management. Usually urologists are the best persons to go to, and they will do a full workout and assessment. There are bladder stabilizing medicines now available which can be taken on a regular basis or on a SOS basis as an emergency medicine. So do consult your urologist if you have any problem of not being able to hold on to the urine, because it can be corrected by precautions and by medicines. There are a variety of medicines that are available. Your urologist will be able to put you onto one, and that may help. Certain exercises like Kegel exercises are important in maintaining the continence. Any exercise that acts on the pelvis should help you. Similar to that, in yoga, we have Moon Bandhanasana. In this asana, all the sphincters are tightened and the muscles of the lower end of the pelvis are also exercised. So be assured that there are medicines which have been in the market for some time, and these medicines can actually stabilize your bladder. I recently had a man who was troubled by his urinary incontinence, and he said that he's feeling like a recluse. He can't go out, step out of his house, because the moment he steps out, he tends to pass urine in his pants, and that's a very embarrassing thing for him. So he stopped going out of the house. I put him on some medication, and as luck would have it, it worked wonders. So now the man is absolutely happy, confident, and he's going out to the shops, to various places where he used to go. So wherever indicated, medicines can be wonderful. And lastly, I want to talk about gadgets that are used. The world of science is developing gadgets every day for various conditions, including urgency and urgent incontinence. One of them is by using the Faradic stimulation of the muscles in the urethra and the perineal region, that is the lower around the penis. That can be stimulated, and the action of the sphincter improved. Similar thing can be done in females also. There is also a seat that is available on which you sit, and it gives many shocks to the pelvic area, which again the idea is similar, to tighten the sphincter and give it the muscle exercises that it requires. So the next time you go out, and if you're a person suffering from urinary incontinence, please be sure to do the precautions that I have explained to you, and also you should consult your urologist to get it sorted out. It would be a nice idea to get a hard copy of this list of instructions, and you can follow them up every time you step out of the house. Tick mark the ones that have been mentioned, and as you do them, and I'm sure you'll find a way out and you'll be all happy and well. If you like my video, press on the like button. If you've got any suggestions or comments to make, please do so in the comment section. And oh yes, don't forget to subscribe to the channel.